everyone, my name is Veronique Maindron and I'm Regulatory Affairs Director at Becton Dickinson, BD Medical in France. I live in Grenoble and I just wanted to give you a few tips about what I'm doing, why I'm doing regulatory affairs and why maybe you should try to do regulatory affairs yourself. So number one, I would like to clarify what I'm doing in this role. So basically my job in the EMA region, which stands for Eastern Europe, Middle East and Africa, is to ensure that medical products from BD healthcare products can be placed on the market and are registered in the 90 countries of this geographical zone and can be placed in compliance with the local regulation on the market. So I manage a team who is locally based in the EMA region. So we basically have some people located in Russia, quite a very big team in Russia, in Turkey, in Saudi Arabia, in Egypt, Algeria, in Dubai, United Emirates, also in Africa, South Africa and Kenya. So as you can imagine, I'm traveling a lot. Well, at least I used to travel a lot. So I have chosen this role because of diversity. Diversity of the task, diversity of the cultures I would be working with, diversity of the teams I would be working with. So diversity, as you can imagine, is one of my biggest motivation in the job. Working for EMA region, I can tell that I am never bored and I'm continuously learning about others and about people. I am passionate by people and therefore EMA was definitely the right place for me. The second reason why I have selected this role is because of the proximity with the commercial team and the fact that I really feel that as regulatory affairs partner, I can open markets for the commercial teams. So I'm very close to the business and I would say this is the way I would define myself as a regulatory affairs person who is trying to be as close as possible from the business and from the commercial teams. Essentially, my daily job involves a lot of interaction with a lot of people. So my typical day would be spent through Teams or Skype previously, having meetings with either my teams, either my network, either my business partners, all of the stakeholders I'm working with. I would dedicate typically 1/3 at least, if not half of my day, to my direct team members, either direct managers working with me, either with skip level meetings on one-on-one. And I would spend normally half of the day, the first half of the day, with the people located in the EMA region. Usually I try to keep the second half of the day in the afternoon to work with the US because the business units are usually located in the US. So I would keep the second half of the day to manage time zone difference just for the US people. I would say when I have time left, what do I do basically? I would try to network as much as I can, either externally with regulators, going through trade association meetings, either internally with different functions or different business people I'm working with. I would also try to read regulation when I have time left. I do a lot of reading for the regulations. Of course, I can't read in Russian or Turkish or Arabic, but I have a very good team who can help me in providing the right translation or explanation when I don't understand something. And finally, something I'm doing a lot is to check data and put together presentation. And I know this might not seem the most interesting piece of the job. However, getting the data, putting the data together would help me in building business case to support when I need resources, for example. This would also allow me to just demonstrate what we're doing, show the evidence that what we're doing is basically securing products on the market, but also providing revenues for the company. Well, I started my career as clinical affairs research manager, building a team for clinical research department, building an own clinical research department. And then I moved to marketing after a jump in a business school to get a business degree. And I would say that working for both an activity which is very close to regulations and for commercial teams, I have found that regulatory affairs was probably the best way to combine both regulations on one side and the proximity with the business on the other side. And I truly understood very fast that in the medical device space, especially IVDs, medical device or healthcare products in general, and in all of the regulated markets, regulatory affair is a can opener. Regulatory affairs are opening markets. So basically the impact of regulatory affair is huge in a company. The question is to sell or not to sell. If you may have the best products in the world, if it's not registered in the market, it simply does not exist. I wish I had known before taking the job that I would be traveling that much. Of course, I was expecting a level of travel. You cannot cover such a large region without traveling. But I didn't expect traveling to the extent I have been traveling, like almost three-quarters of my time, like 75% of the time in a plane or in another place. I do have a family, I have kids, so I would say that potentially the balance was not right at some point, and now I have found a much better balance. Next question is interesting. Am I a coffee or a tea drinker? And I will give it to you to bet on this. And definitely yes, I am a coffee drinker. And I will tell you something. I am a coffee drinker, but I would love to be a tea drinker. I would love to love tea, because when I just look at people having their cup of tea and the wellness and how much they enjoy the smell and the heat of their cup of tea, you can see really their face enlightening when they just take their cup, smell it, and I would really enjoy that as well. Unfortunately, I simply don't like tea. But I would tell you, well, my favorite object, I have it in my hand right now, and this is my cup of tea, my mug, and I will let you know why. Not because of the design of the cup, you would see that I love cats, obviously. Not because it's a cup, not because it's a mug, I simply love it because it's an invitation. You know, it's really an invitation to share and to communicate. And communication is one of my passions in life. I think that a lot of things can be told around a good cup of tea, around a good mug of coffee. And it's not necessarily a very formal activity, but on the informal way of communication, you can also give the unspoken. You can also share the non-verbal information about yourself, about how you feel, about the team. That's where you catch basically the pulse of the organization, the pulse of your team, the pulse of what's going on, what concerns do they have. So to me, a cup of coffee is a rest, it's an invitation to communicate. It's something that you can share with others. Basically, regulatory affair functions are seen as a function who says no to everything. So commercial teams are very creative. They will come with brilliant ideas for expanding markets, for putting more products on the market, for selling to new customers. And eventually they will come to regulatory affairs and they will check if this is feasible or not. And most of the time, what they expect from us is that we will kill their dreams. They're coming with big dreams, and regulatory affairs are dreams killer. What is reality? Do you really think that regulatory affair is killing dreams? I think this is the exact opposite. If a commercial function, a business partner is coming to me asking for, can I do this, can I do that, can I put that product on the market? Most of the time, we will respond, yes, but. Or we might even respond, no, but, and provide an alternative option, because what we like to do and what we're working for is really to help and support the business to put new products on the market. We are really a supporting function to help the business grow, because anytime we're helping the business grow, at the end of the day, it means that we have been helping a patient at the end of the chain. I love to have a 360 view on the product. From the very, very beginning of the idea, it could even be a drawing on a sheet of paper, to the end of the life cycle of the products, where the product has been used or is being distracted or could be recalled, for example. Regulatory affair function will interact with all the stakeholders along this pathway. So if you build a technical file, you need to know everything from the design, basically, to the commercialization. You will interact with clinical affairs, with medical, you will interact with R&D, with quality. You will interact with plant as well when the product will be manufactured. You will interact with quality control to make sure the products that are placed in the market have a good quality. And then you will interact with supply chain, and you also need all along the process to have very strong interaction with finance, with HR. And at the end of the day, you finally end up in being in touch with all of the marketing and commercial and business partners as well. So I haven't seen a function like this which has so many stakeholders. So I really feel like this is a central function, speaking with very different stakeholders, and they all have their own views. If you speak with R&D, for example, they will come with you. They will come to you with some very scientific opinion. So they need evidence-based facts. If you speak with marketing, they will have a completely different opinion and completely different perspective. And this multiplicity of perspective is really what makes the job the most interesting. If I had a magic stick, what would I change? Probably I would try to ensure that there is an harmonized, or let's say more harmonization across the world for regulations, medical device, healthcare products in general. I can observe in my zone so many different regulations in 90 countries, more than 30 regulated countries, and most of them have their own regulations. So it would be wonderful if it was possible to have like one common approach, one harmonized approach, and if the product was registered in one country, it could be recognized around the world. But of course, I would need a magic stick to do that, we all understand. And the second thing I would change, probably I would try let's say in a big corporation or big companies like BD, to get a better access to documents and product information, a more straightforward access, because very often it's difficult in such organizations to access the documents we need to support the registrations in our region. If you're thinking about a career in regulatory affairs and you're asking me for an advice, I would probably tell you one: just give it a try. And that would be my best advice, because if you have a solid scientific background, and if you are not afraid of interacting with many different people, just give it a try, because you might be very well surprised. Don't listen to the perception or the rumors or the way others see the regulatory function. I mean, it's really a function where you can find a place, when you can find your place. If you're a very scientific person, then you will have the opportunity to read through a lot of scientific reports and to challenge scientific data. If you like to interact and communicate, then you will have the opportunity to communicate with a variety of stakeholders. If you like to write, if you're a writer and you can put all together, then it will be fantastic, because you will be able to put good technical files which are really telling a story to our notified bodies or competent authorities about the products, just to ensure the product is safe and demonstrate and give evidence that this product is good for the market and is compliant with the local regulations. So my best advice would be just give it a try, because you might have a good surprise. The number one skill would be to be very well organized and to be able to pay attention to details. It might not be that you need to pay attention to details always, but at times when you go through the data, you will need to ensure all of the data are correct. And why do you need to be organized? Because you will have a variety of tasks to be dealt with, and you will have to manage so many things at the same time, so that it takes a lot of organization and anticipation to be able to manage your files and your submissions properly. So of course, I didn't mention, but English is a must. A lot of regulations are only available in English, or will be only available in English at times. And the last skill, which is, in my opinion, of the utmost important, is your ability to negotiate. So you will have to be a negotiator for your function. You will have to negotiate with internal stakeholders, either with R&D or with the commercial or business organization in your company. But you will also have to negotiate a lot with your external stakeholders, your competent authorities. So if they're asking for a document that is not available to support your product, What can you propose? Instead of telling them that, no, this is a silly request. You have to understand what lies behind the request. What do they really want to see? If they're asking you for a risk management file, maybe what they want to ensure is that you control your risk and that you are compliant with some standards. So what can you provide as an alternative to your competent authority to just ensure that you will meet their requirements? What makes me get out of my bed in the morning? Why do I wake up and I am so impatient of going to work? That's because if I do my job right, at the end of the day, a patient will receive a product from BD, and that product might help him or save his life at some point. And this person could be my grandmother, could be my children, could be my mother. And I'm also thinking that I'm working for a region where BD is investing to place products on very small markets, but very remote market. EMA is a region with a lot of challenges, either political challenges, economical challenges, a lot of wars, a lot of, the situation is evolving very fast, and a lot of people are below poverty level, poverty threshold. And if a big company like BD does not make the effort of serving those populations with healthcare products, who will? So I really feel that I am aligned with my values. When I'm waking up in the morning, doing my job, I contribute in helping others and helping the world of health. In my role, what would be the biggest challenge? So in my role, the biggest challenge so far has been to be able to plead for my region. EMA region is not the biggest region in terms of revenue, but it's one of the biggest regions in terms of needs for regulatory affairs specialists, regulatory affairs support. Because 90 countries, a lot of them below poverty threshold, small revenues, and despite all of these, I still need to ensure that I can build a strong business case to demonstrate the value of what we're doing. That there is an immediate return on investment in many occasions, like for a very small investment, so return on investment can be felt in the same fiscal year. As I said, this is a can opener. We are opening the doors of new markets, emerging markets, and they have a very interesting profile to the emerging market. I mean, the growth is double digit in many occasions. So if we are able to register a product on the market and the product is sold, immediately the return on investment would cover for the initial regulatory investment. So there are two ways of looking at things. Either you would think the investment is too big compared to the potential market, either you can look at it and think, okay, if I'm giving, let's say 10 as an investment, the return on investment will be 100 and it will be in 6 months. So this is what I'm trying to demonstrate, like we are a small country, but the people they deserve to get the products as well in their market, and I will do all I can to make it happen. Resilience. So what does it mean, resilient? It means that even if you fail, it's not the end of the day, it's not the end of the world. Okay, it's a failure, and it's never a pleasure to have a failure. If you're working very hard and you don't get the results that you were expected, of course it's disappointing, but you know what? Thanks to that you will learn and you will do better next time. So a failure is always a way to improve for next time, and that takes a lot of resilience. Allow yourself to be disappointed and allow yourself to be wrong and allow yourself to fail, because the more you fail and the better you will get in the future. Very easy. The word I use the most is alignment. Alignment. And I know it seems very strange to you. It's not regulation, it's not compliance, it's alignment. Why? Because alignment means that basically your objectives are aligned with the objectives of the other stakeholders, whoever they are. So it's about ensuring that what would give me a win will also give a win to the company. And when I'm winning, when my team is winning, I'm winning. And when I'm winning, BD is winning and my region is winning. So alignment means that we all ensure we are working toward a common goal. everything is possible, but nothing is free. And I'm used to say that very often, either for my team, either for the companies. It's all about ensuring that everyone understands the balance between the cost, the risk, and the benefit. And it's also about informed choices. I'm not telling people that they will get everything they want, and I'm not looking for more work, so I might propose an option that is refused or declined by my partners. And you know what? That would not be the end of the world, as long as the decision has been an informed decision and a balanced decision, weighing in the risk, the cost, and the benefit. So it means that you can have many options and many alternatives, but each of the options will have a cost. And depending on how much you are ready to invest, how much risk you're ready to take, you will get a benefit which has been anticipated. So when I'm saying everything is possible, nothing is free, what I'm saying in real is that there are multiple options, and many options are valuable as long as everyone is very well aligned on what is the cost versus risk versus benefit. My goal number one is to ensure that my team goes through the pandemics with not too much damage, and that they will be as happy as possible and as well as possible in terms of well-being in this very difficult year. My goal number two, and that's for BD and for, I would say, the population of the zone I'm working with, I really wish I can place on the market as many products as necessary, so we can really support the fight against the pandemics in the region of EMA, because anytime BD is placing on the market a product, we are helping the world of health.